Welcome to the GumGuru Podcast. Thank you so much for being here with us today. I'm Jason Kong here with Dr. Macon Singletary, and today's episode is called Unlocking the Mystery of Jaw and Facial Pain, your guide to finding relief. And Dr. Singletary, I'm excited for this program here, not just because it's a very interesting subject. I was going to say a very sore subject, but I didn't want to venture into that territory. Yes, of course. But you've also brought in a special guest with us today, Leigh Miller. Leigh, thank you so much for being here with us.
Absolutely. Thank you for having me.
All right. Well, Dr. Singletary, let's start with the basics here. Someone comes in to see you, and maybe they're experiencing some jaw or some facial pain. What's the first thing that goes through your head?
Well, like any examination, you got to figure out, what's going on. You go through the medical history. I get radiographs. I do my exam, and then I ask them. I say, how long has this been going on? Point to where it's a problem. Most of the time, I may be one side or the other. And then, I ask about, medication sometimes can be an issue, but, stress is an issue. And the way the teeth fit together can be an issue. So I have to rule out, is there a dental origin itself, like referred pain? Do they clench or grind? And so these initial examination criteria or evidence of something going on is something I look at first. And then I try to address the issue. And that can be sort of nebulous. Muscle pain, people come in and say, I have TMJ. Well, everybody has TMJ. Everybody has a knee joint. It's a matter of identifying, is it muscle, is it anatomical? So I have to start there.
Gotcha. And, for the patient, that's probably not something that they're thinking about. They just realize, hey, I'm in pain and I would like to not be in pain. So as you're going through these steps, what are some of the causes that might be responsible for causing some of this pain?
So stress is one thing. Clenching and grinding, even going through orthodontic treatment, post-treatment. But most of the time, and Leigh could probably answer this too, I'm sort of like the initial gatekeeper. And if I can't resolve the issue, if they have sleep apnea and they're clenching their teeth during the night, I can address that. There are things that I do initially, isometric exercises. Skeletal muscles have extensors and flexors. They both can't contract at the same time, or it's rigor mortis. They're dead. So you got to get the yeah. And so you got to get the closing muscles to chill. So I may take them through some isometric exercises. I may take them through, anti-inflammatories, and short term, not long term, a couple of days, moist heat. And then if they, I give it a couple of weeks with the isometrics, and if they don't get better, then I'm going, okay, point to it. It can be a radiating pain. It can be the point to the head. And at that point, if I can't resolve it, then Dr. Miller comes on board.
There you go.
I want to ask you, Dr. Miller, more about these causes, because most of us aren't, on a football field or in a boxing match, where there might be like a very logical correlation between why we're experiencing this pain, but that's not the case for most of us. So what are some common causes that you tend to see?
When it comes to causes can be it can hit the spectrum. It can be something that's congenital in nature and you've just developed a bad habit over time. It can be that, you were hit in the head with a dodgeball, all right, and you just didn't realize it until multiple years later. It can be that you had an acute injury. You were running and you fell. Or I have a patient who was a pretty serious biker, and he landed after going airborne onto the hood of the car, right? And it was a pretty serious situation. So it doesn't have to be the weekend warrior type person. It can be really anybody. And Dr. Singletary really nailed it when he said, it's multifactorial. At best, right, just kind of narrowing it down because it is such a complicated topic, but at best it is multifactorial. So, you've got the psychological component. Are you somebody that is dealing with a lot of stress in your life, right? That's going to manifest itself into the physical, and we're going to start to clench and brux and grind and things of that nature, which causes other issues, right? So what is the origination? Hard to say, depends on the patient, But I can guarantee you give me 10 people, I bet you 8 of them have got some jaw pain. It's a very common thing.
That's very interesting, and something that, maybe we don't think about on an ongoing basis. And I want to get to the point of not recognizing this and not treating it, because I can imagine that this is, like most health issues, it's something that you ignore. It's only going to get worse. And we're mentioning stress, and for a lot of people, we can take a step back and maybe find some ways to relieve stress. But some people, their life situation maybe doesn't allow that for quite some time. So what should we do? What can we do? And what happens if we ignore this and we don't seek proper treatment?
Well, from my point of view, if they don't get better, I have to think about, is there a neurological component? Anatomical, like Leigh is saying, Dr. Miller is saying, can be a factor. Do they have a torn disc? Do they have a ligament that attaches the disc to the bone? Is it torn? Is there something really physical, seriously wrong that needs to be diagnosed with radiographic x-rays or something that shows the TM joint in a better fashion? Is there a nerve issue? Sometimes there can be a neurological aspect of this that it is a component that the psych can be a part of it, but there is a physiological aspect or a physical aspect of it too, that if it doesn't get better, it needs to be addressed, because you start doing habit changes, you start to accommodate for it, and that can do your things, and it can cause shifting of teeth, but also mentally it can affect your ability to concentrate. And so I'm like I say, I'm sort of like the first line defense. Once I see something that's not going right, then I'll refer over to Dr. Miller, and it's a extensive exam. Medical history. Going through. I guess you take radiographs, I'm sure.
Oh yeah.
And so to get to where the problem is, and I don't want to say to the root of the problem because that's my specialty, roots. But to get down to where how can we resolve this? If it don't go away after a couple of weeks, then there's something maybe more serious that can be addressed. Now, I can put a person in a bite appliance, and if I really think that's going to be something that will help them. But I sort of screen that to begin with, But bite appliances sometimes will take care of it. But usually the isometric exercises and the anti-inflammatories and most heat, and if that doesn't do it, then there's, if they come in and they're pointing here, and I'm going, okay, let's get you referred over to Dr. Miller and let her look at this.
So Dr. Miller, Dr. Singletary says, this is more in your wheelhouse.
Yeah.
What happens from there?
Well, so, just to kind of bring it full circle, he was talking about first line of defense. A multidisciplinary approach is the only way to address this. You're not going to get to the root of it, if you will, pun intended, right? But you're not going to get to the root of it if you just look at it from the PT, physical therapy point of view, or from the dental point of view. And that is because there needs to be a marriage between the two because they are so symbiotic. A proper splint, right, is essential to allow for the muscles to relax. Think of an angry person in a room, right? You walk into a room and a person is really upset. Well, you're not going to try to reason with them in that moment. There's just nothing going on there, right? It's just like a wall. A muscle is the same thing. So muscles are meant to move things. They're also meant to stabilize things, right? But if they're upset, meaning they're too tight, we're not getting anywhere. And that's when you start to get pain. Pain is just a communication tool. It's just something that the body says, okay, something's not right. Now, are you, like he was saying, is there something going on with the disc? Is this something inside the joint? So that would be more symptomatic. Are you listening to yourself pop and click your joint, right? Are you somebody that your jaw pops out when, you talk sometimes, or yawn? That's a really popular one. A lot of people may come and say, well, I'm not really in pain, but look what I can do with my jaw. I take it to the side, and it's like, okay, that's not good. That's not a fun thing to do. Please stop. But absolutely, when they come in, what I do is from there, if they have any imaging, radiographs from their dentist or dental specialist, then I take a look at those, review those, and I'm looking for where the jaw sits inside of its house. So essentially the condyle in the fossa type deal, if we're throwing out words there. But then what I do is I assess the muscles, right? I get inside, right? We're going to get down and dirty. We're going to go in the mouth. We're going to feel on those muscles, and I'll do a couple of cool moves to see what hurts and what doesn't, if you will. And once we kind of get to the root of that, then we go into treatment. And it takes about 8 sessions once a week. And truly, that's because tissue healing takes time. You know, if you are somebody who's had jaw pain and you've had 1 or 2 treatment sessions here or there, and it's mostly been, let's say, quote unquote, dry needling, because that's the craze of everybody right now. That's just what we like to call symptomatic treatment, which means that it's going to come back. It's just a matter of when and what you're doing, you know. Yeah. So
that makes sense. And I did want to sort of circle back to the treatment road, because thankfully someone comes in and they let you know, hey, I've been experiencing this, and you can lay out the treatment options. What is that relationship like once we've started that road of treatment?
Well, it's if it doesn't resolve, you know, then you know, there's a referral. But there are things too that happened in the jaw joint. You have osteoarthritis, and you can hear that when I open and close, I hear like paper mache crackling. You know, that's one issue. And then there's rheumatoid arthritis too. So those things are significant, and they're ongoing and long term. But if I can't resolve it with the anti-inflammatories, or, you know, like Leigh was saying, they come in and they open wide and say, when I open this, I hear a pop. I said, well, don't do that.
Right.
Yeah.
Stop doing that. Yeah.
I mean, they open up 4 fingers wide. I'm going, you don't normally do that, do you? Say, no, well, don't do that. Right. And sometimes it's a matter of not doing that repeatedly, and they're fine. And it gets better. But after a couple of weeks, if it doesn't resolve, then they get a referral, because you know, Dr. Miller may put them in a bite appliance that opens up the bite a little bit and lets the muscles contract evenly. She does a little bit different appliance than I do, but that's because she's treating the acute aspect of it. I see chronic issues over time that, you know, a bite guard that I make will take care of it. And I usually try to assess that first before I have the patient, you know, invest in an appliance like I make. But it can be nebulous. You know, that's where the initial exam is so important. You know, trying to address, are there other things going on in your life that may be contributing to this? You know, and can we rectify that off the bat?
Right, and you run the risk. I always like to say, no, I'm not the hairdresser of the therapy world, right? Where I get all the stories, but at the same time, you kind of do, just because sometimes there are things that people internalize. So yes, making sure that they're aware that they, you know, may need to go speak to somebody if something is going on in that arena, but also the communication between so it's not just a regular physical therapist, and I do want to make a mention of that. And the reason that I say that is because what I am is called a CCTT. It's a craniocervical temporomandibular therapist, and there's only about 40 roughly of us in the country. There's 5 in the state of North Carolina, and I'm the only one in the triangle, so that sort of goes to the periphery of the state. And it's not necessarily because it's the hardest thing in the world. It's just a very small niche. And what we are trained to do is to actually work properly with the dentist, right, so that the patient gets in a really optimal occlusal place, but also that their muscles can calm down and not fight them. You know, so I'm always communicating, you know, with my dentists, whoever they referred over, back and forth, to say, hey, you know, let's try this splint, or let's, you know, change it up here for a brief period of time, because I think that this will be more advantageous to them. So there's a lot of factors that go into the treatment, and it is not an isolating situation. It's very much a symbiotic relationship, like I said.
Well, Dr. Singletary, you always leave us with our action step before we conclude the episode. What would that be today? Just
if you're having issues, don't ignore it. Get screened. You know, your healthcare provider, your dentist, myself. Get somebody to look at it.
Perfect. And Leigh, if folks want to get in contact with you, what's the best way to do that?
Absolutely. So my business is Miller Concierge Physical Therapy. I have 2 offices, one in Raleigh off Glenwood Avenue, right above Dr. Buckthal, what used to be Dr. Buckthal. It's now Dr. Mary Morgan Kaiser's orthodontic practice, and then in Durham off 55 and 54. My website, Miller Concierge Physical Therapy, can probably lead you to everything you need to know. But do not, my one thing I would say, pain is not always the answer, or the pain doesn't necessarily indicate that something new is happening. It's usually that something's been going on for a while and now it's upset.
That's not what we want to hear.
Right?
That's not what we want to hear, but that's why it is so important to have that pain addressed and bring it up. Make sure you're getting your visits regularly. Leigh, thank you so much for coming on with us today. We really appreciate it. On behalf of Dr. Macon Singletary, I'm Jason Kong. You've been listening to The GumGuru.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the GumGuru podcast, send them to contact@northraleighperio.com.